Hello and welcome to Chapter 2, Well-Being of the EMT. So we're going to talk about well-being, personal protection, diseases of concern, emotion and stress, and scene safety as well. So let's talk about well-being, the importance of it. So keeping yourself prepared for demands and risks of an EMT is important. And if you're unable to function, then your patients probably aren't going to get the best care. So that means taking care of your body, taking care of your mental capacities. Um, it just means overall health and well-being of yourself, so that you can give the best patient care to your patients. So how do we do this? You maintain solid relationships, exercise, sleep, eating right, limiting alcohol and caffeine intake, and seeing your physician regularly and keeping up to date on those vaccines. Um, Now, I know in EMS we don't always get the sleep that we need, but it is important to try and get the right amount of sleep and do all of that. So let's talk about personal protection. So BSI, or body substance isolation, or PPE, personal protective equipment. Either way how you say it, doesn't matter. However, if it's warm and it's wet and it's not yours, don't touch it. First rule of EMS. Okay, standard precautions. Standard precautions are the steps that will protect you from pathogens. Pathogens are those organisms that cause infection. They can be bloodborne or airborne. Bloodborne is exposure to blood and other body fluids, and airborne is those tiny droplets sprayed by breathing, coughing, sneezing, inhaled, or absorbed through the eyes. So when we make decisions about using standard precautions and which standard precautions we're going to use, we want to base those on seeing the patient and the changes throughout the call. Because we may have to upgrade, we can downgrade, but you always want to be prepared. OSHA is the Occupational Safety and Health Administration. They have strict guidelines about precautions against exposure to bloodborne pathogens as well. I'm sure at some point in your career you will do a bloodborne pathogens class, because it is required for anybody who has exposure to those. So refer to local protocols. Your protocols are going to tell you and kind of guide you with what you should be wearing and everything like that. Written policies will also address those and what to do in the event that you have an exposure to some type of infectious disease. Protective gloves. They always have vinyl or other non-latex gloves readily available. Should be changed between patients, and wear heavyweight and tear resistance when cleaning the ambulance and soiled equipment. Hand cleaning, so hand washing is preferred. It is the number one. Vigorously wash hands with soap and water. And then alcohol-based cleaners are considered effective by the CDC and can be used if soap and water are not available. Eye and face protection. So eye protection prevents splashing, spattering, or spraying fluids from entering the body, and should provide a guard from the front and sides. Masks. In the times of COVID-19, we all know what a mask is, and cases where blood or fluid splatters is possible, we want to wear a surgical type mask. In cases where TB is suspected, or COVID-19, or some other airborne type disease is a possibility, we want to wear that N95 or HEPA respirator approved mask. And face shield offers protection of the entire face as well. Gowns can be used to protect clothing and bare skin from spilled or splashed fluids, and wear a gown if a patient has an arterial bleed, or is in childbirth, or has multiple injuries. So let's talk about some diseases of concern. Hep B and Hep C. It's an infection that causes inflammation of the liver. It can live on surfaces in dried blood for several days. Hep B is deadly. Killed hundreds of healthcare workers each year before a vaccine was available. And Hep C, there is no vaccine yet. However, there is treatment for it that kind of puts it in remission. And it poses the same risk as Hep B. Hep B is a 3-shot series vaccination that all healthcare workers are required to have. TB, it's airborne. It infects the lungs. It is highly contagious. There is no known cure for it. It's just treatments. And there is no vaccine. There's no vaccine. You get tested annually. You guys are required to have a TB test before you guys start clinicals. And you can have a positive TB test. All you got to do is go get a clear x-ray, chest x-ray, to make sure that you don't have it active. But yeah. HIV, AIDS, it attacks the immune system, leaving the patient unable to fight off infection. And then AIDS occurs when that set of conditions that result when the immune system has been attacked by HIV. There is no known cure. There are some medications out there that will decrease the viral load, and that viral load is basically what we're talking about when you talk about AIDS and HIV, how much of the disease is actually in your system. And so there are medications out there that will decrease the viral load and prevent spread. It does not survive well outside the body. Routes include open wounds, IV drug use, unprotected sex, blood transfusions, and accidental needle sticks. Ebola, this affects people. It affected people in 2014. It was a big, huge deal. I remember when Ebola was here, we had Ebola ambulances. And if a patient was known to have or suspected of having Ebola, we would call a specific ambulance to come and treat that patient and transport them. It causes hemorrhagic fever, chills, weakness, watery diarrhea, vomiting, abdominal pain. It does have a high rate of death and the lack of definitive treatment. It is kind of hard to spread, but it can be spread through airborne particles. SARS, which is COVID-19 or SARS-19, is spread through the respiratory droplets, and then MERS, or Middle Eastern Respiratory Syndrome, is found primarily on the Arabian Peninsula. Avian flu is found in poultry. It can affect humans. It is not easily transmissible from human to human. And then the flu. It's been around for hundreds of years. In the 1918 pandemic, it killed 30 to 50 million people worldwide before a vaccine was available. Infection control in the law, so EMS personnel and other healthcare providers are at high risk for coming into contact with infectious diseases, and guidelines for workplace safety are developed by OSHA and the CDC. It's just one of those things where we expect to be protected from those things. Our company service is expected to adhere to those guidelines and provide a safe work environment for us. Now, we know that we put ourselves at risk every day, but we should have some type of safety in place for us, developed by those things and used by our services. So OSHA standard on bloodborne pathogens requires infection control to be a joint responsibility of the employer and employee, like I was saying. EMS agencies provide training, protective equipment, and vaccinations to the employees, and the employees participate in an infection exposure control plan. So these are the things that OSHA has kind of mandated for exposures, potential exposures or occupational exposures. So they have to have an exposure control plan, which basically says, hey, if I get exposed to some type of bloodborne or airborne pathogen, then I get treated for it. There's a way that I can report that exposure and various things like that. Adequate education and training, Hep B vaccination, PPE, methods of control, housekeeping, labeling, and post-exposure evaluation and follow-up. Again, all these things are what the company or service is supposed to provide to you as an employee for those occupational exposures. The Ryan White Care Act, this is something that you will probably need to know for a test. It allows EMS providers to find out if they've been exposed to potentially life-threatening diseases while providing patient care. The designated officer for that infectious control plan gathers facts about the potential exposures and then reports those facts and then determines the kind of course of action that they're going to take. In the Ryan White Care Act, again, 2 notification systems, airborne disease exposure and bloodborne or other infectious disease exposure. Once notified of an exposure, the employer will refer you to a healthcare professional for evaluation and follow-up. Again, treatment, finding the best course of action, determining how you were exposed, what could have been prevented to get exposed, all of those things. Tuberculosis compliance mandate, so OSHA's respiratory standard, selection and use of respirators. You wear a NIOSH approved N95 mask when you are caring for a patient with suspected TB. Transporting an individual from such a setting in a closed vehicle, and performing high-risk procedures such as endotracheal suctioning and intubation. Annually, you'll get fitted for a TB or an N95 mask because they do come in sizes and there's not a one-size-fits-all type deal. So you should really be fitted for an N95 annually. And basically what they do is they put a hood over your head and you wear your N95 mask and then they squirt like a flavored mist into the hood, and then if you can taste it, your mask, you're not creating a seal or smell it. So yeah. Immunizations. So immunizations for Hep B, other infectious diseases should be available through your EMS agency. Sometimes they're not. Typically, I mean, you have to have them for your clinicals before you ever get into EMS. So they don't offer those sometimes. I have had a case where I wasn't exposed or anything, but I was chosen randomly out of the service to go and have some titers drawn just to make sure that I was up to date. And titers are just a blood draw that says, hey, you have this in your system, like chickenpox or various things like that, to fight those things off if you've got them. And then regular TB testing may also be required. Again, that may be annually if you're in a high risk or high exposure situation. So let's switch over to emotions and stress. So physiologic aspects of stress. Stress is inevitable in the EMS profession. It's going to be there. Whether that's emotional stress or stress just from the job itself. Recognizing signs of stress and developing strategies to deal with that stress is very important to your EMS career. Having something to do outside of EMS, having something to do, like cooking or baking or running or, just something that kind of takes your mind off EMS. Resilience means toughness or an ability to overcome tough situations. It helps providers deal with difficult situations. and includes understanding stress, being physically and mentally able to respond, and using techniques to mentally process difficult scenes. When you go on scene to a call, it may be a kid call. Kid calls are typically stressful for any type of person. However, they may be different than mine or yours. Mine and yours may be different uh, stress. Whereas I have 4 kids ranging from the ages of 5 to 13. You may not have any kids, and your response to that scene may be different than mine. Whereas I see that child as my own, or potentially one of my own children could have been in this situation, and so my response to that stress is different than yours is going to be, and that's fine. We part of this job is actually doing the job that needs to be done and then dealing with the stress afterwards. And I am able to do that. I am able to kind of put my emotions to the side at the moment, do what needs to be done to help that kid or person or whatever's going on, and then after the call, I can process my emotions and do all of that. So the first stage is an alarm reaction. It is that fight or flight response. The sympathetic nervous system increases activity. Your heart rate, blood pressure rise, and your pupils dilate. In the second stage, you have a stage of resistance or coping. Body systems return to normal. This is also called the feed or breathe stage or system, because it goes back into the parasympathetic nervous system, where it just kind of, you either want to eat or breathe, essentially. You adapt to the stimulus and it no longer produces that stress. The physical, mental health, education experiences, and support systems contribute to your ability to cope. The third stage is exhaustion. This is the loss of the ability to resist, or adapt to the stressor. It occurs when exposure is prolonged, or a stressor is severe. It may cause enlargement of the adrenal gland, wasting of the lymph nodes, and bleeding gastric ulcers. And the individual has lost the ability to adapt to this stressor and may become seriously ill. Acute stress reaction is often linked to a catastrophic event. Signs and symptoms develop soon after the incident. Physical, cognitive, emotional, and behavioral symptoms as well. Acute medical problems and acute physiological problems can occur. Normal reactions to an extraordinary situation. What you're feeling at the moment that this is happening is perfectly normal. It's just that the situation that it is in is not normal. Okay, it may require professional intervention as well.
Bert told me to tell you to shut her up.
Ma'am. Mrs. Carlson. Are you injured? I need you to try and calm. Mrs. Carlson. Can you hear me? Good. Okay. Now, can you tell me exactly what happened to your husband?
So in the scene, if you haven't seen Grey's Anatomy, it will be referenced throughout my lectures. But in the scene, basically what happens is there is a guy and his buddy that come in. The guy gets shot by a cannon. This is his wife, and she has a reaction to it, basically screaming. Her emotions are absolutely running wild. It is a normal reaction to seeing somebody probably getting hit by a cannon. Who's never seen that before? So you see what Karev did. He screamed in her face, and then she became emotional. So she was trying to cope with it at that point. So yeah. Delayed stress reactions or post-traumatic stress disorder. These are signs and symptoms not evident until long after the incident. Flashbacks, feelings of detachment, irritability, sleep difficulties, self-harm behaviors or habits include drinking, and problems with concentration or interpersonal relationships. Delay makes dealing with the reaction much harder, and the patient may not recognize what is causing the problem, and it does require intervention by a mental health professional. Most people in EMS have some form of PTSD, and PTSD really wasn't recognized for first responders until the military started acknowledging it, and we've seen it. So moral injury, this is cumulative stress that occurs over a significant amount of time. Okay, and this is the acute stress type events that eventually just lead to moral injury. I'm a big fan of the term moral injury versus burnout. I believe that burnout is a symptom that occurs after moral injury, but moral injury is what this cumulative stress is. Early signs is that you have vague anxiety, boredom and apathy, emotional exhaustion, not identified. If it's not identified soon enough, then you'll have physical complaints, sleep disturbances, loss of emotional control, irritability, withdrawal from others, and increasing depression. And then at its worst, where it turns into that burnout, is physical illness, uncontrollable emotions, overwhelming physical and emotional fatigue, severe withdrawal, and paranoia or suicidal thoughts. Causes of stress. So MCIs, multi-casualty incidents, calls involving infants or children, severe injuries, abuse and neglect, and the death of a coworker. All of these things cause stress to us, and they're normal things that we don't necessarily deal with every day. So signs and symptoms of stress. There's two different types of stress. There's eustress, which is a positive form of stress, and it helps us work under pressure and respond effectively. And then there's distress, which is a negative stress causing immediate and long-term problems with health and well-being. You'll have irritability, inability to concentrate, changes in daily activities, anxiety, indecisiveness, guilt, isolation, loss of interest in work. All of these things are signs and symptoms of stress. So how do we deal with stress? Lifestyle changes. Healthful, positive dietary habits, exercise, devote time to relaxing, change a shift or location for a lighter call volume, and different call types, maybe more family time. Invisible wounds, so preventing psychological trauma, which can result from tragic scenes such as kids, serious injury accidents, mass casualty incidents, anything like that. This system that takes in stimuli from a traumatic incident may malfunction. So how do we do this? We use the ESCAPE curriculum. It is in your book. So when we use the ESCAPE curriculum, ESCAPE stands for everything. So every patient, S is social support. So we want to prevent feelings of isolation. Tell the patients that you're there to take care of them. Calm, clear, compassionate voice. My wife uses a pre-K teacher voice, as I call it. and she talks to most everybody like that. If you remember back to pre-K or something like that, she uses that voice. It has a weird effect on patients, where they just kind of calm down, they listen to her, and she can basically get them to do whatever she needs to do with them. Choice and control. So replace hopelessness with hope and structure. Choices help provide some type of control. A is anticipate, reduce anxiety and prevent unexpected events. Explain things, what's happening that are happening along the way. Plan and organize, reduce bewilderment and loss. Encourage patients to consider each of the above steps and recognize that there is a plan, and use this every time. Critical incident stress management. It is a comprehensive system. It includes education and resources to prevent stress, and ways to deal with that stress appropriately when it occurs. It is designed to, the debriefing is designed to help responders diffuse after an incident. A team of trained peer counselors and mental health professionals meet with rescuers and healthcare providers involved in major incidents 24 to 72 hours after the incident, and it helps responders deal with stress. There is some recent education that's out there that says that the critical incident stress management is not necessarily helping the way it's set up. It has to be personalized, and it has to be done correctly in order for it to work effectively. But there are some proponents of it, and then there are some naysayers of it. So it really kind of depends on who you get. So reactions to death and dying. We go through 5 emotional stages when we are faced with death and dying, either our own death and dying or the loved one. Occasionally, as providers, we can go through these emotional stages as well, but we don't go through them all. We don't go through them in order, and not everybody goes through them in order. And not everybody goes through them all. So denial or not me. The anger stage is why me. The bargaining stage is okay, but first let me. And then depression is okay, but I haven't done this or that. And then acceptance is okay, but okay, I'm not afraid. We want to recognize the patient's needs, be tolerant of any kind of angry reactions from the patient or family members. Listen empathetically, and do not falsely reassure the patients or families, and offer as much as comfort as you realistically can. Scene safety. So EMS is not usually a dangerous profession. Being aware of potential dangers is always a priority, and determining that the scene safe will be the most important decision on any call. It's becoming a more dangerous profession, unfortunately, in recent times. We do see lots of things that could potentially put us in danger. You know, there are some services out there that require bulletproof vests to be worn on shift. New Orleans EMS on New Year's Eve, they're required to wear helmets from certain times because people shoot up in the air with their guns, and so there's the potential for stray bullets coming down. Hazardous materials incidents. The primary rule is to maintain a safe distance from the source of the hazardous material. Placards ensure that your emergency vehicle is equipped with some type of binoculars to be able to see those placards. Correspond with color-coded identification numbers that are listed in the emergency response guidebook. There is a course that you guys will be required to take as part of being in an EMS system, and that is hazmat awareness if you haven't already had it. You can find it free online if you'd like to take it before you go and get a job. I would highly recommend it. I used to have it required in the classes, but sometimes it was a little bit difficult getting everybody to do it, and so I just don't anymore. But it is required in most jobs, so you'll probably have to have it. Our role in hazardous materials incidents is to recognize that there's a potential problem, and then take actions for personal safety and the safety of others, and notify a trained hazardous material response team. We used to use Cole County as our hazmat team. Now we are switching. I'm not exactly sure who we are switching to, but it was a region decision. And I believe the closest hazmat team now is Fort Leonard Wood to us at the lake. Do not treat patients until after they've undergone decon as well. We'll talk about hazmat incidents and terrorist incidents in much further depth at the end of the course, but these are just kind of give you an idea. Terrorist incidents, so these may be small or large in scale, may include chemical agents, biological agents, radiation, weapons, and explosive devices. Rescue operations, so rescuing or disentangling victims from fires, auto collisions, explosions, electrocutions, and more. We want to evaluate each situation and ensure that appropriate assistance is requested early in the call, and never perform acts that you're not properly trained to do. So the realities of well-being, in some situations you'll have to make calculated decisions between helping a person or your personal safety. Your personal safety always comes number one. When we start doing scenarios, one of the very first things you're going to do is BSI scene safe. That scene safe is paramount. You will fail if you do not say scene safe. And check to make sure that the scene is safe. Okay. Scene safety and well-being are determined by the decisions you make under pressure. Violence. So wear safe clothing, prepare your equipment so that it's not cumbersome. Carry a portable radio whenever necessary and possible, and decide on safety roles. This is your plan. Okay. You want to observe. Survey the scene on approach. Do not announce arrival. Turn off lights and sirens before you get there. And this highly depends on the situation that the dispatchers are giving you when you respond to those scenes. So we want to observe violence, crime scenes, alcohol or drug use, weapons, family members, bystanders, perpetrators, or pets. Reacting to the danger, so there's 3 R's: respond, radio, and reevaluate. So we want to respond to the danger by either moving out of the way or getting to a safe place. Then we want to radio into dispatch saying, hey, we've got an unsafe scene, we need PD or whatever to get out here. And then do not re-enter the scene until it has been secured by PD. So flee, get rid of any cumbersome equipment, and take cover and conceal yourself as well. So when we talk about safety and our safety, there is a course. If you go to work for EMS or Mercy, you will be required to take this course. It's a 40-hour course, I believe, 16-hour course, something like that. That teaches basically it's DT for EMS. It's defensive tactics for EMS. It's how to defend yourself properly in the back of an ambulance or in a house or from any kind of patient. So yeah, there's that class. There's a couple other classes that you can take to kind of defend yourself and learn how to defend yourself. Of course, what we essentially want to do is, in all situations, is verbal de-escalation, and how we talk to that patient, let them make the decisions that need to be made, or let them think that they're making the decisions that they want to make, but you're kind of giving them guidance on. Anyway, this has been chapter 2, well-being in the EMT. If you guys have any questions, let me know. Email, text, phone call, whatever. You can comment on the video down below. So just let me know.